Today I will be presenting the Teen Foundation's Peace Project. Our mission statement is, the Teen Foundation is dedicated to providing equitable and accessible mental health care for adolescents in Orange County by offering no-cost prevention and early intervention services. Overview of the issue. So the issue is that 1 in 10 high school students attempt suicide according to the CDC in 2024. And then the percentage of high school students who experience persistent feelings of hopelessness or sadness rose from 37% in 2019 to 40% in 2023. So that percentage is rising, unfortunately. Some contributing factors have been the COVID-19 pandemic and the quarantine orders resulting in social isolation. Additionally, there has been a heightened use of social media in adolescents, and research studies have shown that greater use of social media is correlated with poor mental health. Some barriers that this population has to accessing services are social and structural. So socially, there is typically a stigma surrounding mental health and mental illness and talking about it with peers. There's also a lack of awareness about what to look for the signs and symptoms of mental illness. And then there are also cultural barriers. In certain cultures, mental illness is not talked about or may even be considered shameful. Structurally or logistically, there is the cost of care, which is often a barrier for families, and low-income families may not be able to access these services. And then there's also the issue of transportation, where adolescents may not have the means to be able to get themselves to places that offer outpatient mental health services. The impact of the issue in the short term is affects a multitude of people. For the client, mental health unaddressed leads to absenteeism, meaning absence from school, increases likelihood of substance use, self-harm, and in severe cases, even suicide. For the family, mental health concerns in adolescence creates financial and relational stress, and in the community, there is an overutilization of emergency services where teens whose mental health has reached a crisis level are now going to the emergency department, which creates a burden on the healthcare workers in that department. For the long term, the impact of untreated mental health in clients are poor academic performance and reduced career opportunities. There's an increased likelihood of criminal behavior, and then there's also the risk of addiction, which are all long-term impacts. Long-term impacts on the family is divorce. The sustained relational and financial stress can put a lot of tension and conflict onto parental relationships and can ultimately lead to divorce. And then in the community, there is an increased rate of imprisonment and disability services utilized for untreated mental health. So we know that individuals who suffer from mental health are more likely to wind up in jails or prisons, and then they are also more likely to become reliant on Social Security and disability benefits, which cost the taxpayers money. So some goals and activities of the Peace Project. So the first goal is decrease symptoms of depression and anxiety amongst high school students, and this will be done through counseling and support services in the form of CBT groups and individual counseling. Second goal is to increase awareness surrounding mental health literacy and the resources available. This will be achieved through education and training in the form of psychoeducation for all students and peer support training through the validate, appreciate, and refer model, in which peers will learn how to effectively listen to their peers and refer them to the correct services, as adolescents in particular are more likely to consult their friends for issues surrounding mental health. Third, decrease social, structural, and financial barriers for high school students to access mental health care. This will be done through advocacy and in the form of student-led mental health campaigns. And then lastly, prevent mental health hospitalizations, which will be done through information and referral in the form of mental health screenings conducted semi-annually and partnership with Soluna, which is a free telehealth service providing therapy to adolescents at no cost, and this can be done remotely. The expected outcomes is firstly reduced symptoms of depression and anxiety in high school students as measured through anxiety and depression screenings. 2, increase student and staff knowledge of the signs and symptoms of poor mental health. 3, increase in percentage of students with a diagnosable mental health condition who receive services. And 4, increase accessibility to community mental health services. For our sustainability plan, we have decided to do a contract with the Mental Health Student Services Act, or the MHSSA, which incentivizes partnerships between public schools and mental health service providers to help reduce this gap in services. Also, we have fundraising. We have a biannual golf tournament that we hold where donations are accepted to play, and it's a really good time, and a lot of people show up. For our agency capability, we have our board of directors. We have Jane Doe, the LCSW program director, and then John Doe is our CFO. We have Jean Doe, the human resources person, and then Jared Doe, who is a philanthropist, and then we have Jay Doe, who is the events planner. Our staff, we have a licensed marriage and family therapist. We have MSW and MFT interns who provide their services and gain education. And then we have our program director. And in the community, we've been recognized with the following awards: Healthy Kid Award of 2021 and the Best Nonprofit of Orange County in 2023.